when I was doing urgent care maxed out, the longest run that I did, you have to understand this, and this violates all types of work laws or whatever.
Mm-hmm.
The longest run that I did was probably about 16 days.
Mm.
And I'm not talking about days. I mean days and nights.
Oh my goodness.
What I was
That's
doing
too
because
much.
I was the medical lead, I was working every day during the day, but we went to a situation where we had to shut down the in-person 24-hour site. But we still had to take on all of the patients for the company, and in terms of answering calls, in terms of prescribing medications, etc. So I was on call for 2 weeks straight on night. So I basically didn't really sleep.
No,
And this was like 16 days.
there's no way
And
you're
at
not
the
going to get
end of
burnt
the-
out.
Even the CMO like reached out and was like, does Dr. Drummond need help with the night calls? And so I had to put out something and get other individuals to help me because it was just becoming too much. But, I will tell you this, and I think, we have to be very careful as healthcare professionals in terms of how we talk about these things, because we all have people who are part of our employees, or even if we're 1099 and we're private contractors, we still have to go and work at these facilities. But I will say that some places will take advantage of you as a healthcare provider from the perspective of, hey, if you're showing up to shifts, we'll just keep you working and working and working and working and not protect you. And you have to protect yourself as a PA, as an MP, as a nurse, in terms of like your own health or your mental health.
Yes.
When it comes to this.
I remember I went to the ICU one time. This was probably like my second or third year of practice. And I went to the hospital on a Monday. And I was on call in the ICU during the day and did the pulmonary service. And then the night guy didn't show up. And they're like, hey, can you do call tonight? And I was like, yeah, it's fine. So I stayed, right?
Mm-hmm.
Then the next day, I got pulmonary, got ICU, whatever. And then they're like, well, the night guy's not going to come. We can't get anybody else. And I was like, all right, I'll do it again. So I did it again.
Yep.
I didn't go home that week until Friday night. I was there from Monday to Friday.
Yep.
I have such a great wife. She was totally she understood my work
Your
ethic.
schedule, yeah.
And she understood my schedule,
Yeah.
so it was cool. But like, I remember that. And then that's when, just like you said, like when you realize that, and again, like I'll get a little controversial here, like the word healthcare provider, like it makes it all the same. So it's like whoever, just HCP, it's just easy to say, just put HCP there. HCP, can you do it? Can you do it? Can you do it? And it just treats you like however, like you're just an object. And and if you have diligence, if you have work ethic, clearly you do, you're just going to say, sure. You're just going to say yes.
Yes, yes,
Well,
yes.
because
Be harmed if you don't.
exactly.
Exactly.
It's not about us.
It's not
about the
us.
company. It's about the patients.
Yeah.
And they use the fact that we have entered a career, because no one in other careers would ever do this to themselves.
No.
But for us, it's like, hey, you know what? You're going to really hurt those patients if you don't. Who's going to take care of the patients? And at some point, you got to ask, well, who's going to take care of me?
But we don't ask them.
We don't
I
ask
worked
that enough.
ICU, and it happened all the time where we kind of had a list, and it was like a set amount of ICU patients that were going to come in, right? Well, if somebody called out, they're just looking at you to continue that 12-hour shift, which at that point is already 14. And it always was like, can you just do like 3, 4, 6 more hours? And it's like, okay. And then, oh, no one's coming at the middle of the night. Well, now we go all day. And it was the same thing. You just go and go because you're looking at your patient that you just spent all day with.
Yeah.
There's no way you're walking out the door and leaving them.